September, Prostate Cancer Awareness Month. And while commonly thought of as a disease kind of affecting men in their 70s and 80s, doctors say it is rising at an alarming rate among younger men. North Bay Dr. Michael Lazar, one of the few surgeons in the country trained in high-intensity focused ultrasound to destroy cancerous tissue.
Happy to have Dr. Lazar with us this morning on the 9. Thanks for joining us. 1 in 7 men is going to be diagnosed with prostate cancer. But is it true that most men don't die from it?
There are approximately 180,000 new cases of prostate cancer per year in the United States, and there are about 27,000 deaths from prostate cancer, making it the second leading cause of cancer death in men in the United States.
Is it preventable, and how?
It's not truly preventable. The best tact is to find it early and treat it when it's simpler and easier to manage.
Right. Well, I'll just mention quickly, I load up my husband with cruciferous vegetables, hoping that makes a difference.
It may help.
Okay, let's
My dad died of cancer in his early 40s. I'm in my early 40s, so this is not just prostate cancer, but all cancers are on my mind. Why are younger men getting this disease?
We're not sure why the younger men are getting the disease. When I started practice, it was unusual to see patients with prostate cancer that are under 50 years of age. Now, it's very common to find them in their 40s and 50s.
What's the youngest you've treated?
42.
Okay, wow.
So what symptoms should we be looking for?
Well, there are no true symptoms of prostate cancer. It's really symptoms of urinary obstruction, which benign enlargement can cause. And then when the cancer spreads to bones and other locations late in the disease, it can cause symptoms.
So we talked about in the beginning this ultrasound technique. What is this surgery that you perform that is not as invasive as others we've seen in the past?
This is remarkable technology. It was approved by the Food and Drug Administration 2 years ago next month. And it employs sound waves that are passed across the rectal wall unfocused. And in the prostate, where the sound waves are focused, it creates a place that's 200 degrees, about the size of a grain of rice. And we literally fill the areas that we want to treat with these grains of rice until we know we've covered the cancer where it is. Now, this allows us to treat portions of the gland, and the side effects of prostate cancer treatment with radiation and surgery, which we've historically been limited to, they had high instances of incontinence and erectile dysfunction. With this technology, we have almost no incontinence at all, and erectile dysfunction is down to 10%.
The screening itself is not particularly, we're not talking like a colonoscopy, right? I mean,
no.
You can get this done in the doctor's office somewhat easily.
A simple blood test and a rectal exam to check the prostate are the way you screen for it.
Okay, and
Mike should have that done every year.
Good. Starting at what age?
Well, because he has a family history at 40s.
Okay.
Yeah.
All right.